Hello, my name is Irina Marcoff. So we're going to be talking about unlocking neuroplasticity and improving enhancing function through movement-centered therapy. I'm the owner of Central Physical Therapy and founder of TheraYouth Foundation, which is a pediatric clinic for children in lower income neighborhoods. Okay. Oops, sorry. Okay, we're going to be talking today and understanding how neuroplasticity works, the role of neuroplasticity in physical therapy, the importance of good sleep, nutrition, and neuroplasticity, how stress and emotions affect neuroplasticity, and how our skills develop through neuroplasticity, and reproducing executive function in it. And we'll conclude it with case studies. Okay, what is neuroplasticity? It's basically the ability of function to adapt, to recognize new ways from the day we're born. I always say it's a fancy medical term to describe brain's ability basically to learn and adapt. I call it mental muscle. And brain is in a way muscle, just full of electroneurons. Think of neuroplasticity as internal rewiring process that allows your mind to grow and meet new and increased ways to function. The presentation will show how movement-centered therapists can harness neuroplasticity and improve children's function. It will show how certain physical therapy interventions are applied to facilitate neuroplasticity in children of all ages. We will provide advices if you have any questions, if there are therapists or parents, whoever is today present at the webinar. Okay, neuroplasticity, basically, like I said already, the medical term to neuroplasticity is the brain ability to change and adapt through life due to our experiences, which we call learning. It involves formation of new neurons, connections, and recognize existing ones. The key processes of neuroplasticity always involves changes in neural structure and in synaptic transmissions and our neurochemistry. These changes are always observed through our life. It's just the speed of it changes with our age. Examples of learning skills shows how our brain grows through neuroplasticity. Every time we learn a new skill, it's neuroplasticity. Adapting to injuries, if we had traumatic brain injury or stroke, anything like this, that affects one part of the brain, other part of the brain adapts by taking on the function and helping to brain to recover from the injuries. Brain's ability to rewire itself is very important in brain's healing. Otherwise, we would never recover from certain injuries that happen to us. There are very two important mechanisms that neuroplasticity happens. The first one is a structural plasticity. That's actual structure of brain and how the structures within the brain change through the synapses formation and pruning. Another way is functional plasticity. Functional plasticity. It allows brain regions to take over the function, like I mentioned before, with the injuries, to affect the development by taking on the part of other brains, taking on the part in function. Neuroplasticity and development includes three major parts through which it happens: is motor skills, cognitive development, and emotional regulations. Those are the three major that we're going to look at. The motor skills is basically any movement that we engaging into. And from day one, as we're born, rolling, turning, walking, it encourages brain to put new movement patterns. And cognitive developments, or neuroplasticity, is learning and memory as children experience through the environment. And as we grow through, actually we have hearing, we have vision, we have touch, and all of that affects our cognitive development in turn. Emotional experiences contribute to neural development and influencing behavioral responses that we challenge throughout life. We're going to move to the next one. So as I mentioned earlier, neuroplasticity, it always there throughout entire life. The difference is that when children are young at infancy, the neuroplasticity is the highest. That's why early intervention is important until age of 3, because this is the most you can accomplish. And as the child grows older, the neuroplasticity is there. It's always there. It's with age just getting slower. So the older we grow, the slower is neuroplasticity. So in infancy, the brain grows very fast and synapses form with extreme speed, which lays the foundation for new learnings for basically our entire life. As we're toddlers, the motor skills and language affects neuroplasticity and growth of it. As we moving further to preschool and into school, that's where the cognitive abilities and social skill developments kick in more and help to brain to grow and increase the plasticity. We will talk about physical therapy and neuroplasticity. So physical therapy is an important part and became one of the primary therapeutic intervention to promote movement in recovery of children, especially those that have neurological deficits or neurological challenges. Through movement-based therapy, kids can harness the power of neuroplasticity, and it can improve their abilities to improve their function in life and overall well-being. This approach not only helps in rehabilitation, but it unlocks new paths for development and improves the quality of life of children and young people. So we will move on to the next slide. If I'm going too fast, please let me know. Okay, we'll talk about physical therapy intervention that's applied to facilitate neuroplasticity. So constraint-induced movement therapy. So it's also called rehabilitative strategy. Is it aimed to improve the functional use of an affected extremity and the force use of the impaired side for those who were impacted by stroke or any other neurological conditions, like cerebral palsy, for example, or during TBI. The exercise may be used to regain arm and hand function, for example, like doing a functional task that may be recommended to include in that you're using the affected arm. You can start it with simple exercise like opening and closing the affected arm, and then moving to a functional work like using the fork or a spoon. Reaching across the body is the exercise, and then moving into grasping various items. It's all while using only the affected arm, not the other arm. Neurodevelopmental treatment, also known as NDT. So NDT is characterized by hands-on therapist-guided facilitation of movements, and it provides sensory input and into the group of muscles through its proprioception. So focusing on NDT is important because it helps to normalize the tone muscle and improve postural control and specific handling techniques. NDT is widely used in movement patterns like rolling, crawling, sitting, and we'll show you later the case study how I utilize NDT a lot in facilitating the movement in children whose muscles are not engaged. The task-specific training involves repetitive practice, repetitive movement, functional tasks, repetitive functional tests to improve motor skills and neural connections. So those are task-oriented training. For example, if the child can't roll, so you performing the same movement over and over, stimulating the roll, and then progressively adapting to a more challenging movements. Next is proprioceptive neuromuscular facilitation, which is also known as PNF. It's another therapeutic approach that promotes the response of nerve impulses and recruits the group of muscles that nerve innervates, again through stimulating proprioceptors. It's in a way, it's a hands-on. And I would say, you would say probably, why do I have manual therapy separately? Because manual therapy, I put only when it's a direct manipulation of muscle or joints or fascia. So next one is staying separately, which is manual therapy, and it's grouped with the joints and muscle manipulation directly, also manipulation of fascia, which is important to facilitate normal tone in muscles and eliminate restrictive movements, or stabilize. On the other hand, like we all know, the joint compression helps to release the proprioceptive response and increase the stabilization in joints. And the last one, which is not the last in general, but important, therapeutic exercises. Those are the repetitive movements, which I personally always select for my patients specifically to their problem. And my goal and education to parents on that. So it's done every day, a few times a day outside of the clinic, like other educational points. Okay, we're going to move on from physical therapy interventions to, oops, sorry. Okay, so the experiences of brain stimulation, they happen through sensory exploration. We create opportunities for children to engage in various textures, sounds, and smells. Like I mentioned before, we experience the world through vision, hearing, touch, and it all is brought to one muscle called brain. I call mental muscle. So creating different textures for a child to touch, different toys with different texture, different sounds. We usually get more attention from a child when sounds are involved, soothing sounds or nice smells that stimulate neural connections. There are tons of therapeutic toys these days that can be used for children. They just have to be picked carefully for each child individually. We always looked into new physical challenges, introducing age-appropriate obstacle courses or games, sports the child was not exposed to before. And it's the sports that's enough to challenge the motor skill that child is lacked. And helping at the same time with obstacle courses, it also helps with the problem-solving abilities. Creative arts is excellent way to stimulate brain. It encourages participation in music, dance, drawing, which or even therapeutic. Those are excellent ways to cross motor neural integration. Strategy. So as children grow older, we still stimulate neuroplasticity until pretty much the day we die. And adaptive sports are always good way to encourage children to stimulate brain. It's just modifying the sport to their abilities and to their level of activities is important. Their motor skills and social interactions help them to progress further and improve their function. Visual is this time is a great, we live at the time when actually virtual reality also is a big part of people's lives. And utilizing a virtual reality is a great way to challenge the environment for motor skills. If the child can climb the stairs, but you are having the VR that they are climbing the stairs, it can help to stimulate brain and them trying to reproduce the movement or trying to mimic the movement of climbing stairs. Peer-led activities. Incorporating group activities is important for children for social emotional support, not just for physical support, because children learn from each other. That's a lot of times happens when children go to daycare. They actually develop faster an emotional and gross motor way because they much more prone to mimic each other or learn from each other than from adults. And a lot of times the younger siblings, they are much more progressive in their function because they're learning from their older siblings. Yeah, moving to the next slide. So what neuroplasticity, obviously it's not such a smooth way, but there are challenges, and the challenges are the three major challenges that I put in there is individual variability. So individual variability, it means each child needs individual approach. One child can respond to therapy by utilizing the texture, and another child may respond by utilizing sounds. So those things have to be taken into consideration when planning a plan of care, and considering child's personality is important as well, what child likes or what child doesn't like, and incorporating it into the treatment. Maintaining motivation is important. Again, if the child likes something, that could always be left for the end of therapy as a positive reinforcement to increase the motivation to participate and do what they like less in order to get to their prize. So keeping child motivated is important. They want to respond to you positively, and when they respond positively to therapists, they respond to treatment positively as well. Environmental factors is a very big important factor. It influences and impacts child's ability to engage in any activity and benefit from neuroplastic intervention. So the environmental factors is such a factors like family, how much is involved where the child is, in the environment the child is living or the school is going, seeing what else is child doing besides coming to therapy. So those factors are very important to collect in order to incorporate into better therapeutic plan. When you collect all the information above, it's also much easier to educate parents and caregivers. You can give them a better teaching tools and understanding how they can help their children. By providing the clear explanation how the brain adapts and how brain changes through the experience and how the child will benefit from doing certain interventions that you ask them to do, like therapeutic exercises, or when we teach parents to do joint compression, how it's important and why it's important, or utilizing to you or encouraging to use affected arm, how it helps the brain to facilitate neuroplasticity and improve the function of the affected limb. Recognizing progress is important, not just for therapists, but for caregivers, for parents to see how their child progresses from not rolling to rolling, from rolling to sitting, even just bringing arms to midline and holding something in their hands. It's important to recognize that, because it also going to help to move to the next step. Okay, so continuing with the patient education, when we talk to parents and guardians and caregivers, it's important to explain how routines are important in child's development. Especially, everybody knows autistic children, routine is absolutely essential for them. So routine for any child is an important progress in improving neuroplasticity. In the morning, should incorporate exercises. They can be exercised if the child needs to do the exercises. We can explain how, for example, the balance exercise can be done during brushing teeth by standing on one leg or by stretching their calf muscles. For my cerebral palsy kids, I always teach them how they can stretch their calves while standing and leaning like hypotenusa on a sink. And they absolutely love it. During playtime, encourage activities that they love and challenge their skills. Make it challenging in order to improve the movement and coordination. always ask parents, unless the child is infant, what kind of games they play and what kind of games they like to play, and find the way to incorporate movements or like doing certain activities in quadruped while playing a ball if the child is not able to stand. At bedtime, very important bedtime, how the child relaxes. And they can always do gentle yoga is excellent way to relax the body, relax muscles, especially muscles that have imbalance in neuroconduction and causing either too much tone in body or too much stiffness throughout the joints. Promotes body's awareness as well, where your body is more relaxed and where it's not. So teaching from childhood relaxation and body relaxation is very important. So sleeping, so relaxing the body before going to sleep is, again, we said it's important. And one of the ways it can be done is also through meditation, as well as relaxing and breathing exercises. Those exercises, I can provide them, but I'm pretty sure everybody knows the breathing exercising and meditation. Meditation doesn't have to be in sitting position. You can be always laying in a comfortable position, as long as your mind are working on relaxing the entire body or working on not having any thoughts. So what happens during sleep? Sleep is essential for neuroplasticity. There are few things that are happening that are important in that process. It's called memory consolidation, brain recovery, and brain recovery. So what's memory consolidation? Transfers the information from short-term memory to long-term memory. Whatever the system consolidation takes place during slow wave sleep. And the concept of the active system consolidation during sleep tells that memories are reactivated during sleep to be consolidated or solidified. And those memories, not just how we memorized somebody's name, but how we moved, how we danced, or how we sang a song. Basically, anything that was going throughout the day that was considered as a new learning task, it consolidates during sleep in our memory. And it happens, like I mentioned before, through slow wave sleep. Also, memories are transferring from short-term to long-term, undergo qualitative changes. And so I would remember things that we may not ride the bike for 10 years, and then we sit at the bike and we're able to ride it. So it also helps to consolidate preferential memories with relevance for the future plans. So whatever you will learn today, it's going to help us tomorrow. Also, sleep produces qualitative changes in memory, like the extraction of certain conscious knowledge from specifically learned materials. Next, brain recovery and memory consolidation are very essential for neuroplasticity. So by optimizing sleep and establishing consistent sleep routine and creating sleep-friendly environment for a child is very important in the process of enhancing neuroplasticity. Moving to next slide, we're going to talk about nutrition. Nutrition and neuroplasticity, like everything else, closely connected. Whatever we consume, whatever we do, it goes to our central nervous system brain. So omega-3 fatty acids are very essential for brain health and in turn neuroplasticity. All those omega-3 fatty acids are found in fish, flax seeds, walnuts. These days it's easier than it was 50 years ago, because if somebody can have fish or nuts, there are supplements that you can take if you're not able to have nuts. Children have nut allergies or flaxseed allergies. Some people are vegan. So the supplements are important to be considered. Antioxidants, they protect the brain cell from oxidative stress. And antioxidants are very rich in berries, especially raspberries, blackberries. Dark chocolate is another way, even though a lot of times children don't really like dark chocolate. But leafy greens and salads, that is another source for antioxidants. Hydration is very important. Our brain consists pretty much out of 90% of fluid, so hydrating and bringing fluid to the body, it supports neuroplastic processes. Impact of stress on neuroplasticity. I consider that very important to cover, because as we teach children new tasks, we cause stress. But when we cause that stress, it's considered acute stress, short-term stress, which actually can enhance memory formation, which we discussed before, and potentially benefit neuroplasticity. So acute stress, when the child learns new task, new activity, pretty much as adults, when we learn something new, we feel a little bit stressed. I am very stressed right now doing this presentation, but actually acute stress is good for our bodies. What's not good is chronic stress, the prolonged stress, that impairs neuroplasticity and reduces the synaptic plasticity and neurogenesis. So we don't want to have acute stress turn into chronic stress. So we have to make sure that the child is stressed for a short period of time when they learn a new task, but then it becomes nice and pleasant by them also seeing their progresses. If we see that the child is not able to transition from acute stress to chronic stress, we have to make sure to utilize stress management techniques. And again, breathing techniques, they're very powerful to decrease the stress. Meditation, yoga, those are great stress management techniques that we have to make sure to incorporate when the child is not able to transition from acute stress into, actually, when the child is not able to get out of the stress mode. Let's put it this way. Sorry about that. So we're going to move to a next slide. Okay, into emotional regulations. Neuroplasticity and emotional, I'm sorry, I apologize. For some reason, it typed emotional twice. I guess I was very emotional during all this. Mindfulness practice. And there are three big parts: mindfulness practice, cognitive reframing, and emotional literacy. Mindfulness practice has, like everything else, again, we have to see at the age appropriate techniques and strengthen their emotional neurosequence. So mindfulness practice, I break it into 5 main components: is meditation and walking meditation, not just laying or sitting meditation. Actually, walking is a great way to meditate. Second one is, again, breathing. Third one is engaging your senses, teaching a child to engage the senses, to tune to the environment, their own environment, through sight, sounds, or smells. Like I would ask a child to touch certain texture and ask them what they feel, how they feel, or if they feel that certain texture would have them think of certain colors. Observe, and then observing the colors. Also, I teach parents that it's important for a child to have mindful eating. So when they eat, they're not just eating, they're actually engaging their senses and maybe telling parents how it tasted to them, what they were feeling. With older kids, we utilizing the gratitude journals and mindfulness practice by documenting things that child is grateful for or thankful for. That gives child also reflection onto their own progresses. Cognitive reframing or cognitive restructuring is vital to various psychotherapy approaches. And we're not psychotherapists, but we still use it by teaching our caregivers and our teacher and our children to recognize the negative beliefs and improve them ultimately. Like the child says, I can't do this, but we are telling that, no, you have to say, I am capable of doing this. Even simple things like when your child says, I can't do well on this test, and you tell them, no, you will do well on the test. So that's reframing their cognitive ability on doing things. Emotional literacy is understanding how emotions unfold and change one's behavior and thinking. Basically, making sense of emotions. And the 5 main aspects are knowing your feelings, so the child knows the feelings, having sense of empathy, learning to manage our emotions, which is very important, especially as you grow. We have to manage our emotions pretty much every day, and repairing our emotional problems. The last one, pulling it all together in order to be able to reflect on it. Okay, neuroplasticity is more learning. The important things: repetition, repetition, repetition. So we're consistently repeating motor skills that needs to be mastered, that needs to strengthen the neural pathways and improve its performance. Feedback. It has to be timely and specific. It's important to know that the child or caregivers give a feedback at the timely manner. And giving feedback to the body, it's actually directly, both ways and indirectly. Introducing variability is important because variations in practice is important to enhance skills, like reaching, not just straightforward, reaching across or reaching to the side. It increases neural flexibility. So in order to assessing the change, standardized tests are one of the ways to see how things are improved and progressed. And those Denver Development Stress Test, for example, Ages and Stages Questionnaire, Bayley's Scale of Infant and Toddler Development. There are multiple of assessment tests that can be used. Along with that, behavioral observation, which documenting changes in daily activities and daily skills. And as I mentioned, positive journal that caregivers and children care keep can be documenting those everyday activities and skills. Neuroimaging, something that we don't have in hand, but doctors do. Those are the MRIs and other neural images that available to bigger centers. But we can always acquire the test results from there and read and compare and see in the long term the differences. Sensory processing and neuroplasticity, like we said before, assessing the sensory processing changes through tests and interventions, same implementing targeted sensory integration activities and promoting adaptive responses that helps the neural recognition. They recognize if you touch one texture, next time you touch it, you recognize that it's the same thing. Generalization supports the transfer of improvement sensory processing skills to our daily life. So whenever we did something small, then we can apply it in every day of our life. Once the child learns how to put the shoes on, he does it every day. Neuroplasticity and language development. I am not a speech therapist, I'm a physical therapist, but in our pediatric practice, we have amazing speech therapists, and I felt like I should include a little bit about language neuroplasticity and language development. The critical periods, recognizing when the speech develops in order to maximize the interventions for speech therapists to maximize neuroplastic potentials. Also including multimodal approach, which including auditory, visual, kinetic means movement experiences, strengthens the language. So when the child plays a game, developing the language is much increases the chances to improve the language faster and improve the neural networks. Social interaction is what we do every day, and promoting language development helps children to go into stronger, socially healthy adults. Neuroplasticity and social skills development. So from small tasks, our goal to get children to everyday social skills function. And peer interaction, as we talk, facilitates structural social experiences to strengthen those social cognitions. Perspective taking is important when the child is engaged in activities that promotes empathy and theater of mind, enhancing social brain circuits. Problem solving, teaching strategies to navigate through social challenges. And in our therapy offices, we do such a simple things. We start with simple things like obstacle courses, promoting adaptive neural responses. Neuroplasticity and music therapy. We use soft Mozart program for our children. I've seen in the past 10 years how rhythmic training really helps children to increase or facilitate neuroplasticity. I've seen it in my autistic children. Really having milestones thanks to music and learning the musical instruments helps auditory processing plasticity. Music-based skills are very important in emotional regulation. Again, it helps to reduce stress. So if you're able to have any exposure to music, it's a great way, it's a great intervention in therapy. And like I said, we use soft Mozart program. Fine motor skills, the same like with my speech therapist. We have amazing occupational therapists that do a miracle job with our children, and they include into neuroplasticity activities like precision grip activities, which challenges fingers to take small object pincer grasp to facilitate fine motor neural pathways, having hand-eye coordination, engaging the activities that involve visual processes and closely connected to fine motor control. That's a bilateral hands integration by using two hands at the same time that stimulates both hands and strengthens both hemispheres through its neural connection. So the neuroplasticity of cognitive rehabilitation is important attention training. So our children need to learn how to implement targeted exercise, how to be able to focus, and we implement certain exercises to improve their attention network and cognitive control. Memory strategies, teaching mnemonic techniques and other memory aids to strengthen the encoding and retrieval processing from our memories. And it is important to recognize, we understand how without memory, basically, we're not able to evolve or progress. So problem-solving techniques, they directly connected to the memory strategies because we're able to retrieve from memory what's the best way to deal with the situation. Next slide is executive function is, again, working memory, cognitive flexibility, and inhibitory control. Those are all together. So the working with memory, we already talked about it. Cognitive flexibility is ability to regulate our stress, ability to debate, ability to emphasize or being able to put yourself in somebody else's shoes, changing directions, reading and comprehending simultaneously. Those are all cognitive flexibility. Inhibitory control, also known as response inhibition, ability to control our attention, behavior, thoughts, and emotion. So they are on the motor level and attention level. Motor level is a motor behavior which manifests in hyperactivity. For example, when a child is in class, they may be able to control themselves from getting up, but when they get bored, they not able to sit there anymore. So this is attentional level. It's, for example, if the child reading a book and they get distracted by a sound outside. And lastly, behavioral also manifestation, inhibited control is, for example, when we, out of frustration, throw something. So all that is important to to be aware of in order to improve neuroplasticity. Neuroplasticity and cerebral palsy, again, utilize a lot constraint-induced movement therapy, treadmill training if your clinic has one, and bimanual training is when we utilize requiring both hands work together, promoting, again, interhemispheric plasticity. Future direction of neuroplasticity is, again, continuing to utilize personalized intervention, approaches to individual neuroplastic potential of each child and genetic factor. Neurotechnology will help brain we will have more and more access to the brain, and through brain-computer interfaces to enhance the neuroplastic intervention. Studies show that environmental factors interact with genes to influence neuroplasticity across lifespan. So genetic, also studying and know more about the gene helps to understand neuroplasticity and enhance it. Now we'll move on to case studies. If we are beyond the time, please let me know. We can go just through 2 case studies, not 3. Let me know about that. So the first case study, I put it first because I think he's the most interesting case study that you don't see every day. And I was going on by the, and I thought if we have enough time, I want to make sure this case study is presented. So the 2-year-old diagnosed with Joubert syndrome. The case study number 2 is 5-month-old boy diagnosed with oligocephala and torticollis, and case 3 is 3 years old and 4 months old girl diagnosed with cerebral palsy. Case number 1. Okay, he came to TheraYouth at age of 2 years old. The child never had a chance to receive an early intervention due to the long wait. So the Joubert syndrome is the known as cerebral vermisogenesis, where the cerebellum is malformed or absent. In actually Ray's example, the cerebellum is absolutely absent. There's it's a rare genetic developmental disorder, and it was identified first in 1969. The symptoms can vary, but definitely impair the visual, gross motor development, language, and in turn, of course, social functional skills. It has variety of different ones, of different medical conditions that children can have, but we're going to talk specifically about Ray. So a beautifully 2-year-old boy, he was evaluated by in our clinic by me, an occupational therapist. She is absolutely incredible. In May of, I made a mistake, 24. So he came in May of 24, last May. It's not 22. He presented with severe hypotonia. Basically, there was no movement. He was laying there, but he had passive movement. There was no contractures or spasticity. Hypermobility through upper cervical was quite severe, not just through all the joints. And there was no postural control. Babinski reflexes were still present. This is basically Ray, the evaluation. Unfortunately, we do not have videos of pictures of Ray until almost 2 weeks of treatment. We were not able to obtain permission for quite a while from parents. This is, again, he was unable to roll, to sit, to bring hands to center. None of the movements were available to us. Visual processing. This is the ray. Basically, 4 weeks after therapy, his eyes are like bunny eyes. He had no central vision. He was not able to focus on what's in front of him. This is him after 12 weeks of therapy. His head control is improved. His eye coordination is improved. His rapid eye movement was absent, which basically improved by 12 weeks of treatment. This is not Ray, but I put a video of another child just to show how we start. I always start with children like Ray with passive movement utilizing PNF and NDT, just peripheral neuromuscular facilitation and neurodevelopmental treatment. I'm gonna press the video, oops, sorry, play, and I'll show. So I'm facilitating, my fingers are right here on muscles. This is another child, and doing passive movements, teaching the body just how to move passively. And when I feel the muscle contraction, I start doing active assistively. So the first thing we were doing, we were just rolling supine to prone, prone to supine on the ball, because with ball I was doing slight bouncing, which helped to stimulate proprioception at the joints. And so that's what we were doing from 1 to 4 weeks pretty much. And once he started actively move, we moved on to sitting. And this is 5 to 8 weeks of therapy. So we're doing a lot of joint compression in this, and then putting him in this position, preparing and teaching him to get into quadruped and pushing himself. So my hands are on his hip flexors, pushing and stimulating right there, pushing on purpose further so he can pull and work towards himself. So you see, he's pushing out. But prior to that, we were doing it passively. So also you have to take into account that first I try to do, if there's no muscle facilitation at all, do it in a gravity eliminated position, and then gradually introducing the gravity. This is 9 to 14 weeks, him already being able to actually weight bear through 4 proximal points. Okay, so, and again, utilizing the NDT a lot, and having manual tactile, having my hands on the muscle bellies or at the joint where the tendon attaches the joint, which is a powerful point with the peripheral, with the proprioceptive facilitation. This is 15 to 8 weeks. So he's able to sit independently, weight bearing through his feet and sitting with just the contact guard, but really there is no touch. This is him already trying to be totally independent. Here we have amazing occupational therapist working on bilateral movement, but also incorporating the weight bearing where he already is able to do. So in this video, I don't know how to move this one out of the way, but oops. I don't know. I'm not able to move this away to show the video, but you can see my hands are on transverse abdominis and in the back on the erector spine muscles, to stimulating the postural control while weight bearing through the knees. Closing, moving further and getting more successful, moving to the proximal standing. So, I'm sorry, You see, my hands are on glutes. I apologize that the pictures, I didn't expect I'm going to be presenting when we were taking pictures. My hands were on his glutes, stimulating the glutes, and also switching from latissimus muscle to gluteal muscle, which are extensor muscles. And when I needed, I would press at the same time at hip flexor muscles. When he get tired, he would just relax and then pull himself. Me just putting hands on his latissimus muscles would give him a cue to stand up. We were already transitioning to single leg stance. While he loves this toy, so I use that toy a lot to engage him. And look at his head control. It's beautiful. It's 23 weeks of therapy. Oh, here is where already I'm starting to teach him how to walk. So he's not walking yet, but we're starting to send the impulses to brain by moving the alternating knee flexion extension and forcing that, which is going to be a future. This small movement is a future for walking. Here as well, the hip flexors engaging in the walking. So that's, see, putting right there and in the back on the gluteal muscle. Case number 2, 5-month-old boy that had muscle tone disorder, extension tone during birth complications, plagocephaly, resulted in torticollis. You saw his video how we're teaching him to roll at 5 months. He could not lift his arms up. He was always crying and was turned always into right side rotation. So that's passively turning him and extending. And from there, moving into sitting. Also do a lot of stretching for kids who have tightnesses. I use the ball, they love the bouncing, and use the gravity to stretch throughout the body a lot. So this is, this is teaching him how to weight bear through 4, and basically today he is rolling and crawling everywhere. This is a video of teaching him how to use his hands and recognize that he can use his hands for crawling. I actually used some of his extension tone into my benefit because the gravity pulls him down even though he tries to fight. So adding some joint compression at the same time, you could see that movement that loosens up the muscles. Small isolated movements, it helps to loosen up the muscle at the same time, stimulate the muscles and joints. And here, trying to, you see, same thing, compressing through the pelvis and standing. Preparing this kid for the future walking. He's already today caught up with all his milestones and moving on to the world. Case number 3 is a cerebral palsy girl. She came to us again. She never had a chance to receive the early intervention. So she, at the age of 3, pretty much couldn't do anything, had severe contractures, and was always in a bad mood, crying and yelling. And this was her 3 weeks after therapy. So we're using the little cues. She loves ball, she loves bouncing on it. So we used it every time when I felt she's getting tired and she needs to relax. I would use the ball as a positive reinforcement. Tactile muscle stimulation of the muscle bellies. So my tactile stimulation was mostly on the muscle bellies in order to relax the muscle. This is her 6 to 8 weeks where this is at 6 weeks, this is at 8 weeks. Look how relaxed her hands are compared to 6 weeks. So because all that nice, beautiful stretching and joint compression helps the muscle to get proper neurotransmission from the brain and from muscles back to brain. Okay, those are small videos, again, teaching how to quadruped, because before we teach her how to walk, I really want her to be able at least to navigate on all fours. And she's not happy about it. We talked about that acute stress. So I'm putting the things that she likes in front of her, and I really want her to be able to actually lift one arm, which she did eventually. Like in this video, she's already able to put her arms here and there. Similar technique that you saw me do before, but free, and you see how she pushes herself with her arms. So she actually has awareness of her arms now. She's no longer have them flopping around. And that's when we already moved on to teaching her how to stand. Parents were amazing. Her father was very involved and stretched the girl as we instructed, was participating in her, still participating in her treatment tremendously. Conclusion, embracing neuroplasticity is important for any therapist who is not just working with population that has neural issues, but I think just in general, improving anybody's life. And combining movement-based therapies with other services and other interventions only maximizes potential of the neuroplasticity. Our mind grow, and they constantly grow, and stimulating our brain helps us to be healthier pretty much across our entire lives. And collaborating with other therapists, teachers, and caregivers is important part of successful therapy. Thank you very much. Again, my name is Irina Marcoff, and forgive me if I had bumps on the road, because I'm on top of everything, I'm dyslexic. So thank you.
All right, thank you. All right, so we have a couple questions coming in. A couple questions around the therapy sessions. So one question is, how many therapy sessions per week did the children receive? Another is the therapy done daily for so many hours at a time? I work in a school system and see kids twice a week. Progress is slow.
So we actually, because our clinic is was designed to begin with, that we want to be able to cover kids who fall through the crack. It means the kids who don't receive anything. And we try to see who needs it the most. Like Ray was getting therapy 3 times a week, where Baby was getting it 2 times a week, because parents were very involved and helpful. So it depends. We also see we have a child where parents are not involved. So we're trying to keep him on the load so the child keeps progressing. So you have to really look into environment again. If the child gets something from school and they're progressing pretty well, then I'll just keep the child. Maybe if I need to do something that's not done outside of our clinic, once in 2 weeks or once in 3 weeks. But if child is not progressing and we need to push him, I may have him once a week. And if parents are involved, that may be enough. But if parents are not involved, unfortunately, there are situations or caregivers like that, especially in lower income neighborhoods. You may meet that kind of situation a little more often. Then we keep the child more frequently in order for them to hit the milestone they need to hit and be able to function normally in society.
Great.
Were I able to answer that question?
I think so, and if not, you guys can follow up with some follow-up questions in the chat box. But while we're there, another question came in. Can you provide some examples on what you do to improve attention?
Okay, so that's a great question, but we use, it depends on the age, whatever kid likes. Like with Ray, you saw that toy that he likes on wheels with the music. I use that a lot to gain to do my intervention, but he's able to focus because he loves those toys. So, or you can use certain characters that they like. Sometimes you'll be surprised, but sometimes if the child in the beginning especially is out of control, I may ask parents to bring iPod and have their favorite show on. And I would slowly in the beginning use that iPad and then slowly wean it off, or use it after in the end, telling child you'll get to watch it in the end if we do this and this. So basically using that as a bargaining chip for their attention.
Okay,
Sometimes, yeah, if parent allows, I can actually sometimes with older kids again, like having a sugarless lollipop, sucking on the lollipop helps the kids to focus.
perfect. Another question coming in. Can you tell us what type of kids you see in TheraYouth, and how do you get the parents to follow the home program?
How do we get them follow the home program? As parents, we teach them, and they basically, the most parents want the best for their children. And I always have a session with divided if I need to see how parents do with kids. So I actually ask parents to show me what I taught them, how they do it with their children. I actually ask them to do it with me. And obviously, when they do it well, you understand that they're practicing a lot. Sometimes I give them, besides that, I give them printout what needs to be done. And I make them make videos while I'm doing things that I'm teaching them so they know. Because when you teach somebody in the clinic when they're so nervous and coming home, they may not remember. So I actually have them video the educational session part and have them play it at home when they do it. And then I ask a couple of times parents to ask another guardian to videotape them doing, so I want to make sure they do it right.